Diaz here, and I'm going to introduce her in a few minutes from My Ombudsman. So really psyched. And I see Carrie's here with me too. And let me make you co-host, Carrie. And looking forward. A lot of friendly faces, a lot of folks I recognized. Great to see. If I start naming everybody, I mean, I see at least 6 people right off the top. So it's a pleasure to see all of you. I'm going to just hand Carrie some controls. And the recording's on. I think everybody's hearing that as we come on. Anyway, it's April 11th. April showers are still coming. Hopefully we'll have a, if it gets warm, we won't be so paranoid, right? Because it is April. I just saw a cartoon somewhere and it did say that. It said, oh, I guess now that we're in April, I won't start freaking out if it's a really warm day. It's appropriate, I think. But life has been so challenging for the past 2 years, right? It's 24 months and counting for so many of us and so many others that, are isolated, in our world. I wonder, I don't know, Leslie, I would think your job would get even harder. And yet in some ways, people might isolate even more and not call you. In another way, when I heard that the numbers were flat for MassHealth, like PCA and related services, I said, well, that's not good because people need more, not less, right? And for some reason, they thought that was a good thing, which I guess, they got to put a good face on it, right? When the hours don't go up during a time when people don't have day services or school, right? Kids in school getting, I think one of our colleagues got 2 hours for the 36 hours. Her teenager wasn't in school. That was for lunch only. Because again, and this is an interesting thing to tackle. I haven't talked to Bill Henning yet, Leslie, but it's a new, actually DPC would be interested in this too, obviously, because it really struck me with the new GPS and recording devices. So I'll give you a heads up that some people have told me they're paranoid to bundle their time. So, and for you in the audience, let me just give you a great example of that. And it's a systems issue. It's not technically an ombudsman issue, but it is from a systems point of view. It's an ombudsman's issue. But what one of the two different folks told me is, how you get minutes, right, for certain activities. And for example, toothbrushing. And I forget I think it's 15 minutes, believe it or not, for toothbrushing. And I assume, they feel like they're going over the top to give 15 minutes, but whatever, 15 minutes. But these two folks were told by their PCM, Personal Care Management Organization, that, geez, you better be careful if it's 15 minutes and you then bill a couple hours, you better make sure you're documenting that they came for just that 15 minutes into your home. And for some people, right, who have, disabilities, it's not like they have a ton of hours, right, that they need hands on hand and assistance. So it's something new I never even thought about, because I'm telling the person, well, why aren't you bundling, have someone come for 2 hours, whatever. Who is going to go to someone's house for 15 minutes? That's not going to happen, especially in the morning, So it's an interesting problem. So Leslie's got her hands full. That's a long way of saying she's got a challenging job. And I'm really glad she's doing it. So thank you for the work you do. And let me show you guys, I'm just going to share my PowerPoint for a few minutes, and then Leslie's going to take over with her PowerPoint, okay? And let me get to the start here and share the slide. So we already know it's April 11th, so let's move on, right? And just remind you about our mission. I'm not going to read our mission today because I already ate up a bunch of Leslie's time and I want to have enough time for discussion today. So, and again, we actually intersect on cross-disability issues with DPC and other organizations, and we're glad to do so, especially on the crisis standard of cares 2 years ago, when there was a lot of work on that. And then today, I want to put a plug in, folks, for you to go on the Action Center, and I guess we have to give you the direct link, which is up somewhere, but direct link to the Action Center, because there's been some issues going off our page. But this is a time for House Ways and Means and Senate Ways and Means to be, hanging in there and communicating with your legislators, and look at the fact sheets that we have set up on advocacy state house budget. And then these are the things we're doing coming weeks. We're continuing to do Mondays at noon, except for the holiday next Monday. It's Patriots Day. It's also a federal holiday. People know that. I didn't know that. They made up a new federal holiday because they were jealous of Massachusetts, I think. And so that's why your taxes can go in a little later. Interesting, huh? So on the 15th, believe it or not. But I guess, no, they gave it the Friday, not Monday like us, right? So they got in, they squeezed in that extra holiday. We'll have to look it up. And I hope it's for a good reason. I hope it's like Black History Month related or an issue like that that's totally underrepresented, right? And then Maura and Ellen do their, monthly webinar on federal and state government affairs. And Carrie has her special webinars that go on. And you can always donate to us. It's always, there, but we don't push it really hard. So pretty exciting to introduce Leslie. She's a first generation Peruvian American. And I'm not even a first generation, by the way. I was almost 4 when we arrived here. So my kids are first generation Armenian American, or who knows? They're a motley background, diverse. She's graduate Wellesley College, not too shabby. Great school down the street here. Our office is in Waltham, so not far away. And her career is focused on healthcare and access, including interning in Lima, Peru with Partners in Health, which I'm pretty sure you did some work around AIDS and right, those kinds of issues. And Partners in Health is a great organization. She lent her skills to a health clinic aiding migrant farm workers in Connecticut. Who knew there were farms in Connecticut? But there are, especially right in the Northwest part of, I guess Kerry Mahoney would know that too, coming from Connecticut.
Tobacco farming is a big.
Is it really?
Yeah.
Holy Ghost. Oh my goodness.
Exactly right. Yes.
And she's also worked as a vision therapist, which is what I think you did, right? Before putting this hat on, I think. And thank you. Somebody chatted in that Friday's Good Friday. Of course, I do celebrate that, but I come to work too. But that's it. I should have come up with that. Thank you very much. Anyway, it was through that experience with people with brain injury, traumatic brain injury, that she then arrived at the Disability Policy Consortium, which hosts My Ombudsman, and she's built it into a responsive program to improve healthcare access and access to long-term supports and services. But if you talk to many of my colleagues, they're going to say there is no healthcare without access to long-term support and services, right? Charlie Carr and others over the decades, Paul Spooner and others. So, and then let me show people, I think I copied one of your slides things, but you're gonna get into this. But it's just a lovely brochure that they have to give people a heads up. And I'm gonna get off this now, stop my share. And Leslie hands you the baton, I should say, and look forward to your presentation.
Yeah, thank you so much, Leo. I appreciate the introduction, and also what you spoke about earlier just is a perfect example of the types of things that we want to hear more about from people. This issue about folks who are getting PCA hours in such short discrete amounts of time that aren't really useful for them. And it's one thing writing it into policy and then seeing how it plays out in real life. And I think that's what, as an ombudsman program, that's part of our work, is to see how some of these policies and procedures and whatnot are actually playing out in the real world, in the lives of people with disabilities, people of all backgrounds. And sometimes we have to tweak them and hope that by people reaching out to My Ombudsman, we can report on some of the things that are happening for people on a systemic level. We do give services to people one-on-one and try to resolve their issues that way, but we also have a responsibility to report to the state the types of trends and issues that we're seeing. So definitely the more that we hear about these concerns, the more we can report to MassHealth and other folks who are involved in all of the behind the scenes of healthcare access. So yeah, I appreciate also the background on me. That was a cool little write-up. I have to probably thank you for that, because I know I know there was a longer version of that that Lee Templeton, our community outreach manager, also helped out a lot with, just putting it into Yes.
Got me a longer one, and I'm big on. I do that on myself all the time. They'll get 3 sentences on me, and that's
Perfect.
it. And it's But yours, I just wanted people to get the full picture, and
Yeah,
I figured people could ask more if they want to know.
absolutely. No, thank you. I really appreciate that because a lot of my background is having navigated the healthcare system for my parents, whose primary language was obviously not English, since they immigrated from Peru. And for the majority of my life, also I had to navigate both legal systems and healthcare systems and whatnot for them to help them navigate the world. And so that was one part of my experience that really led me to my interest in healthcare access and public health. And then, as you mentioned, right before jumping into the world of My Ombudsman, I was also part of a vision center that helps people with traumatic brain injuries, but also other types of developmental disabilities, including visual processing issues, with their vision, improving their vision and helping them navigate the world with visual accommodations and things like that. So all of that led me to here. And so I will definitely be happy to dive right into My Ombudsman and what we do. So again, I'm Leslie Diaz. Nice to see all of you and meet all of you. I'm the director of My Ombudsman, and I'm going to share my screen now so that we could see the PowerPoint that we have all fancied up for you. And I hope you can all see it. Looks good. All right, cool. So, yeah, looking good? Great. All right, so if you have any questions along the way, I'm happy to take them as well, but hopefully we'll also have time at the end to answer any questions or comments. So I wanted to talk about My Ombudsman, which I'll go over through in terms of our mission, what we do, who we are, and how we can help, and then how you can reach out to us if you think that you might need our support. So one thing that we like to ask the folks who are meeting us for the first time or learning about us for the first time is to try to think back about who you go to for help or support. Obviously, the ARC is one big support and resource for people out there, families and folks who have disabilities. And I'm talking about just in general healthcare access. You might look up something on Google if you're looking for information about how to file an appeal, if you got something denied, or maybe you'll reach out to a friend or a loved one who's been through a similar situation with healthcare access issues. You might even reach out to a provider. Maybe you have a really great PCP who helps you coordinate all those different services and resources that you need to live an independent life. But who do you go to when you have health insurance issues, especially if you're a MassHealth member? Who do you go to for that sort of support, that one-on-one guidance? And that's who we want to be. That's what My Ombudsman wants to provide for MassHealth members, is the information that you need to make informed decisions about your healthcare access rights and your benefits as a MassHealth member. So that leads into our mission, which is to ensure that MassHealth members understand their healthcare rights and health plan benefits so that they can get the care they need. So we do this by empowering individuals, including their families and caregivers, to exercise their rights and access these MassHealth services. And as Leo mentioned earlier, we are operated by Disability Policy Consortium, and we're actually funded through a contract with MassHealth. So we have the background of being operated by the DPC, which many of you might already know as a long-standing organization that helps advance the rights of people with disabilities. And obviously through MassHealth, we get the support that we need to be able to reach all MassHealth members across the state. One really important part of being part of the Disability Policy Consortium is that it means that we're rooted in disability rights. So My Ombudsman is unlike, I want to say almost all other ombudsman programs in the US, in that we are housed in a nonprofit that's run primarily by people with disabilities, which we're really proud of, because that really informs how we approach the issues that come our way, how we listen to the stories that people tell us about their issues with healthcare and MassHealth in particular. So that's a really big part of what we do, and is part of our training We go through a disability history rights training as well to make sure that we are fully informed of what the different paths are that lead people to reaching out to My Ombudsman for help. And because we have staff members who are disabled or identify as being disabled, we also can, really understand where people are coming from when they're running into obstacles and frustrations. We know that it's not just a one-time thing. It can be something that they've experienced over and over. And so we're here to help people help to provide support people that way. And because of that, we're also focused on member rights, disability rights, member rights, healthcare rights. All of those things have been long and really worked hard to be recognized and to use and access. So we always go back to what is this person's rights in this situation, if there's this challenging situation that they're navigating, and really trying to remind them of their rights and what they can do with our support. So I'll get into a little bit more specifics now. So, just instead of talking just big picture about how we can help on a more wide scale level, let's talk about what we actually do day to day. So on the day to day, we provide MassHealth members with information on how their insurance works. So there's so many different types of MassHealth health plans out there, different types of levels and benefits. So if there are questions around that, we can answer those questions. And then what their rights are. So depending on what plan you're in and how the rules are that work in that specific plan, you might have different rights to certain benefits or to certain resources and different processes for each plan. So we try to help explain to people what those are. And also who to ask for support. We know that MassHealth has been working really hard to integrate their work with community-based organizations, community partners. So we're also trying to expand our knowledge of those organizations that are based right in the community that can help people directly who already have relationships with the community so that they can be better assisted more directly. So we're really expanding our reach, and just like with the ARC, we hope that we can continue expanding our reach there. So I mentioned a little bit already about just giving information about benefits, services, and member rights. And then in addition to providing information on how to do that, we provide the one-on-one support, the one-on-one help in getting those benefits and services. And we might all know that navigating that process can be really confusing, and there could be a lot of paperwork and back and forth, contacting one vendor, contacting another doctor, contacting your specialist, et cetera. So just getting to that one benefit that you know that you need, or that you know that your loved one needs, sometimes you need additional support in navigating that process, and that's what we're here for as well. And as I mentioned earlier, making sure folks know how to exercise their rights, and we really hope that by doing so, we're encouraging self-advocacy as well. So here's just a list of all the folks that our program can help. So we have resources to help anyone who's enrolled in MassHealth, including Medicare and MassHealth separately. So some folks are dually eligible and they'll have both Medicare and MassHealth. We have folks who reach out to us from the One Care plan, SCO plans, PACE plans, MassHealth fee-for-service. We can also help folks who have MassHealth Limited, which often covers folks who are undocumented. So we're happy that we can finally do that. We recently expanded to helping MassHealth fee-for-service and MassHealth Limited members just earlier this year in January. Folks who have the ACO and MCO health plans, over which there are about, I want to say, more than 35. So hopefully lots of people, that fits hopefully lots of people's, check people's boxes off. The primary care clinician plan, PCC plan, and folks who get support through the Massachusetts Behavioral Health Partnerships, MBHP. So just a little bit about our team so you know who we are. As I mentioned, many of us have lived experience with disability. That's true for the DPC as well as My Ombudsman, including myself with mental health needs. And we're also part of culturally and linguistically diverse communities with in-house staff who can provide services to members in various languages, including Spanish, Portuguese, Haitian Creole, and American Sign Language, which I'll go into a little later. We have diverse work backgrounds. So as you heard, I've been through quite a variety of different experiences before landing here in My Ombudsman. And similarly, other folks have had a great amount of experience in things like counseling and housing, immigration, public health, research, social work, and also self-advocacy, because again, many of us have had to navigate the system ourselves. We also have a department that's dedicated to the deaf and hard of hearing community. It's run by Lori Seidman, who is the only deaf healthcare ombudsman in the country. And that's why I mentioned earlier that we also provide services in American Sign Language, because Lori is fluent in ASL and can provide services to folks who are deaf or hard of hearing who, even if they don't use ASL, but identify as deaf and hard of hearing, she has the skills and cultural knowledge to help people navigate those situations in their primary language and with their disability needs in mind. So we're really proud of that. So now I'll go into My Ombudsman's role and try to give you an example of something that we've helped members with before. And this is meant to show just kind of like what we hope to see, or hope folks will see us as a bridge between them and their MassHealth benefits. So if you're on a bridge and there's traffic, which I'm sure we're familiar with, and there's lots of barriers and obstacles getting to in your way, we hope to be the bridge that gets you from one place to the other. So if you need help accessing your medications or durable medical equipment, or the long-term services and supports that Leo mentioned earlier, all of that is part of what we see as healthcare access, definitely. So we definitely would work on issues like related to PCAs. And so we would hope to be this bridge that helps connect people to those resources, to those benefits that they're entitled to as MassHealth members. So we do that by listening first. So when you reach out to us at our helpline, real people will answer the phones, real people will answer our emails. They are called our community liaisons, and in my mind, I always think of them as our first line responders, because they're also the ones who escalate issues if they're really emergent. We've had situations on Friday afternoons when someone's medications run out and they can't get it approved by their insurance, and they're not sure what to do, and we try to really help address those issues right away. So real people answer the phones and email. We're always there to listen first, because we believe that everyone's story matters. Everyone's story matters. So we offer support, ask questions, and help people figure out those next steps. And then some reasons that people reach out to us might be because they need help filing appeals and grievances. So an appeal is when someone has received a denial from their insurance and they need help filing an appeal, which is basically just a request for the insurance plan to reconsider that decision. Often there's a lot of steps involved in that, and if not, even if the steps are pretty straightforward, there's also a lot of paperwork that you might need to fill out to really support your need for this service. So we try to help people know where to go and who to ask for help from. Grievances are more like formal complaints when you have an issue with a provider. Maybe you felt mistreated, or maybe you felt like there's a vendor who could have provided a bit better customer service, or what have you. Anything that you're dissatisfied with, we can help people file those grievances. And if people don't want to go down the formal route of filing an official complaint, we can help mediate as well. So as an ombudsman, we're here to help mediate situations between people who, like I said, don't want to take that formal route, but do want to at least try to either repair a miscommunication or repair a relationship, maybe with their provider, maybe with their office, the provider's office staff, etc. And then the rest of it, really entails quite a variety of things like transportation, people who use PT1, people who use transportation through their health, some of their health plans that are offered, like the One Care plans. There's care coordination, which people, when they reach out to us, it's because they have maybe 5 different types of DME, some single-use DME, some not, others that have home health services and need to coordinate that with their physical therapy. So all of these things, that at least moving pieces, can really be aided by a care coordinator of some sort. So we try to help people connect to care coordination if that's available through their plan. And then the other long-term service and supports and medical equipment, and also provider access. I know one big thing that's been coming up is that folks are having trouble finding PCPs, finding behavioral health specialists because of the long waiting list and lack of availability of providers. So that's another thing that we definitely want to hear about more and see how we can help. So I'm going to give an example of an issue that a member might reach out to us about in particular and how we would navigate that. So let's take Carla, for instance. Carla is bilingual, but is maybe a little bit more comfortable speaking in Spanish. And she recently had a stay in the hospital. She's actually about to be discharged from the hospital because of a major surgery. However, Carla doesn't feel ready to be discharged, and the reason is that she feels like she's going to need a lot more supports at home than usual. However, she's not sure what's in place yet, and it feels like it's going to be pretty urgent for her to leave soon. She's feeling the pressure from the care teams at the hospital. And so Carla reaches out to my ombudsman and lets us know what's going on. We ask her some pretty straightforward questions like, what's your health plan? Get those out of the way, and really try to get to the core of, okay, what is it that you need to feel comfortable to leave? And then we try to mediate that with their provider. So I'll go into the next slide where we really try to work with the member. We're always working with the member. So the member reaches out to us. Again, they call our helpline, they get in touch with the community liaison. And in this case, if Carla's telling us that she's going to be discharged in like 2 days and she doesn't have anything at home that she needs yet, then we're going to most likely mark that as urgent because we need to attend to this right away before they essentially discharge her from the hospital without her being ready. And so the community liaison will escalate that most likely. The ombudsman will be assigned to a case. The ombudsman will be assigned to the case according to whether it's Spanish-speaking a member or Haitian Creole. So we have an ombudsman who will work with the member, and then they'll communicate back and forth with the member, with the health plan, because we do want the health plan to know what's going on with one of their members. We also want them to be aware that the member is feeling, as she reports to us, confused about why she's being discharged so soon. She doesn't have what she needs at home yet. And also we want to make sure we're communicating with any providers that she wants us to communicate with. So if the member says, that she doesn't agree or isn't feeling ready to leave, then we'd ask for her permission to speak with some of her providers there, maybe even a social worker there who's working on her case, just to make sure that, the member has all the details that she needs to know why they're currently in the process of discharging her, and vice versa. So if and we would, of course, express anything that the member wants us to express too. If she's uncomfortable about leaving, then we would try to help mediate that situation too and let them know this person, Carla, isn't feeling ready to go home yet. What do we need to get her to be comfortable to go home and get her ready? So we find out then that the member is in need of various home supports. So after doing some investigation with the member, with the team at the hospital, we find out that in order for her to live independently at home after she's discharged from the hospital, she would need to make sure she has a hospital bed and also a visiting nurse to come help her with the wound and bandaging care. So we want to make sure that those services are in place. So we have to make sure the plan knows that those things are going to need to be authorized soon, authorized and approved so that they can find vendors as soon as possible. We would need to inform both Carla along the way as well as her providers as to what it is that we're working on. And hopefully by this point, we're working with the hospital. We're working together to make sure that Carla has these services and benefits in place, as well as the hospital bed in place. And then she might need to continue, after we figure out the correct or the most appropriate discharge date, we would also want to make sure she knows what she needs moving forward, because it's not just this situation that she might be in. It's once she recovers, what other kinds of things will she need? Maybe she was getting PCA hours prior to this surgery. So does she need more hours for the time being until she recovers? You know, things like that, where we'd want to do a little bit more investigation, not just leave her with a resolution for this issue, but trying to think about preventatively what could be down the road for her that she also needs support in. So we try to provide her with that information, knowing that knowledge is power, and also connecting her to various support systems that MassHealth may offer, so that she's not alone and again in this moving forward. And this can apply to anyone. We don't always see situations that are as urgent or as complex as leaving the hospital, being discharged. As Leo, you mentioned earlier, might just be something about needing additional hours. And we can help people work with their PCM agency to figure out why the assessment turned out to say that this member needed only so few hours, and what we can do to try to increase that if possible. So we help people navigate through that. And then some ways that we're different from MassHealth customer service, because certainly folks can reach out to MassHealth customer service or even their health plans if they need help with any types of issues that we just described. But they primarily focus on eligibility and enrollment issues, whereas My Ombudsman focuses on actually getting those benefits and services. So even though we don't help with eligibility and enrollment, we're really there after, once someone is enrolled, what happens next. And because we're separate from MassHealth, we don't have access to any of their health plan records until we have your permission. So we won't be able to see what medical records you have or what appeals or denials you have on file or any types of things like that until we have your permission. And then we can reach out to MassHealth to get that information, and only that information that you allow us to have. And so because we're not part of MassHealth or any health plan and don't have access to those records, we really are able to stay neutral and look at all sides of the story, since we're not seeing it from the MassHealth perspective necessarily, or even entirely from the member perspective. We're trying to stay neutral and see both or all sides. But we are also really, working in support of the member, in support of you, to make sure that you know how to use these rights that you have as a MassHealth member. And so we also hope, as I mentioned earlier, that we get to hear more and more about what people are experiencing on the ground as MassHealth members, because we hope that by doing so, we can report to MassHealth and other stakeholders and hope to identify ways to strengthen the MassHealth program and other types of healthcare access policies and processes that sometimes we are all dealing with independently and individually, and there's power in the collective. And so the more that we can raise these issues to the forefront, I hope the more strength there is behind it. So in summary, My Ombudsman's mission is to help individuals exercise their rights and access the benefits they have as a MassHealth member. And we're really proud about our team's combined experiences, because they allow us to approach members with understanding, with respect, and with expertise in a variety of areas. But I'll say that we're always learning as well. So we learn every case that comes in, every issue that comes in is always slightly different. So we're always learning something new. We abide by a listen first philosophy. And so we acknowledge that members are the experts on what they need. So you're the one living that life. You're the one who's going through the ins and outs of navigating these systems, these services. And so we know that we prioritize what it is that you're asking for. And we serve as a bridge between members, their health plans, and the healthcare system in general. So again, we hope to make all of this just easier for people to not navigate these challenging systems that can be very complex. So that's my little spiel on My Ombudsman, and here's our contact information. To contact our helpline, we have our phone number there, but you can also, if you are an ASL user or deaf and hard of hearing, you can use our video phone to contact Flory. And also we're available via email. You can also look us up online. We have also a Facebook, which I should probably put on here. But that is another way to get in touch with us as well. So feel free to reach out, and I'm happy to take any questions if there are any. Let me know, Leo, if I should stop sharing my screen as well.
Thorough. Yeah, let's shift the questions and take the thing up. And you know what? When you get a chance, maybe let the other Leslie can send me the PDF version of your PowerPoint, and we'll share it with people, because this recording will get posted, and we'll send it to everybody who attended. Yeah, so yeah, that was really thorough. Thank you so much. Anybody want to jump in? And clearly, you're a lot different than customer service. Okay, at MassHealth, let's be really clear on that. There is a customer service, but given experiences people have had and with customer service, I think they are pleased to know there's an alternative. And, you know, again, I can't believe it took this long to get you here. And it's really because Jeff Kielsen had been working with you guys and sent me a note, could you publicize this? And I said, publicize it? Geez, of course, but why haven't we had them on? So anybody have anything? Yeah. Anybody want to? Yeah, Carrie.
Yeah, no, I'm just, you know, I'm feeling very silly because I thought you were all part of MassHealth, and it really gives me great excitement that you're not, and you have a totally different approach. And so great work you're doing. That's wonderful. I can't wait to spread the word even more.
Thank you. Thank you so much for saying that, Carrie. Appreciate it.
Carrie oversees education and outreach for us, Leslie. Oh, cool. So we have like resources on our website and things like that. So she'll make sure you're known pretty broadly in our world as well. Anybody else want to? You know, I have a question if no one else does. But oh, Carolyn, let me see. It's in the chat. Whom do you typically deal with? Is it a member in a group home, unable and unaware of his or her own insurance, a guardian, case manager? Oh, that's going to be an interesting answer, Carolyn, because she's really working cross disability. So it's really a broad population. So she's wondering, you know, is it the individual, him or herself? Is it, you know, a family member? Is it a guardian, a case manager, an agency? What do you think if you said, hey, you know, who are the people that call you and ask for help?
Yeah, that's a great question. It's really all of the above. If someone's in a group home and they don't necessarily have their insurance card on file or even know where to look for what type of insurance they have, we'll most likely end up hearing from a guardian, another family member who's reaching out on their behalf. A case manager often will reach out to us. We have some folks at different, for example, independent living centers who are case managers of various folks who reach out to us for support and giving both the case manager and the member support in navigating the issue. So we're happy to work with anyone as long as we have documentation that the person is allowed to talk on that person's behalf, or verbal permission from the member themselves. So we're happy to work with anyone else who's involved in that person's care.
And Leslie, Diane's asking that dreaded question, which is the reapplications or redetermining eligibility that people get. And do you help with those? Some of them, those are pretty big applications, right?
Yeah. And Dan, maybe you have a little bit more information, but would this be for like the Commonwealth MassHealth plan?
Yeah, it's probably for MassHealth. I mean, yeah, it's probably for people that, I would think for, so that's a great question. It's adult child, so I would think it's a MassHealth redetermination. Is there a way to get around that if you have a documented disability that's lifelong?
As far as I'm aware, and I can't speak to it entirely because that area, enrollment and eligibility, isn't really our expertise. It's so complicated. I don't think there's necessarily a way around it. However, we do have connections with some organizations that can help with this process because yes, it is. I'm not surprised to hear 40-page applications that it can get really complicated getting back into this. So Diane, I see you have your hand up. You might have wanted to add.
So yeah, I did hear of one parent talk about this in a meeting, and I have a friend who said she just went through it and she called and called and called, couldn't get through to anybody. If she did get through to somebody, they just said, yep, that's the application, fill it out. She finally filled out all 40 pages, delivered it by hand. And then I think she got a call from someone who said, you know, you didn't have to do this. There's a renewal application. but apparently nobody knows about this renewal application. The application they're filling out is basically to get somebody into a nursing home, as I understand it. So, I mean, again, I've only heard of 2 cases, but I'm not out and about. So I think if I've heard of 2, there's probably a lot more.
So Diane, Carolyn just said, and Leslie, Carolyn just said, she's had to do the renewal 3 years in a row, and it's 30 pages, even the renewal. So it does seem, so that might be a systems thing that the ARC should look into, as well as DPC and others, because that, along with this whole, time thing, which has gone up because of the new devices, the new tracking that the feds wanted to have. So just to give people background, right? The federal government instituted a check-in on the PCA program that's based on some kind of GPS system. So that's why this has gotten more in the forefront. But that and the application, the 30-page thing, it does help get rid of people, I would assume. It does cut back on numbers, doesn't it?
Well, also when you call MassHealth, they lost one year, they lost the form. They told me they were going to remove my son because I didn't file the form for him, and it wasn't true. But when I called in, there's no way to route quickly to an office that deals with adult disabled people under age 64. I finally found out you have to go down the phone tree for the people over 65, the senior, because it's as if these people were seniors in a nursing home. That's the same status. And it's crazy. You have to submit bank account information, trust documents. They ask you all these questions about, real estate, 5-year look backs, your spouse, they don't apply to young adults who are, and it's bizarre. And I think it really does need to be looked into.
Thank you, Carolyn. Thanks for giving us the background.
Sorry for the venting.
Thank you. That's really helpful to know. I mean, I'm happy to answer more questions, but that was one of mine, is like, what are some of the issues that you're hearing, seeing, experiencing out there that we could potentially look into, or at least put some feelers out there for other people who are in need of some help with them?
Yeah, this has come up in parent groups too. The parents of adults in residential are just really beside themselves about this particular situation.
So I think with the new administration, this could be an area we could, work on. My hunch is probably in the several months that are left, probably we're not going to get much traction, though we can bring it up with Amanda Castle-Craft, new director of MassHealth. But, my hunch is they're going to want to study strategy, on what the implications are. One last question. I have one if nobody else. I mean, I guess I was wondering, like, out of those topics you identified, right, that are the most common, what do you find the most difficult to work through, do you think?
That's a good one. I think some of the more challenging cases or types of issues that come our way are those that do involve either long-term services and supports or care coordination, because it really varies what folks know about it coming in. There are so many different terms and acronyms and meanings for the same word out there that people might use them interchangeably. And so when we're trying to explain what someone's benefits are, we really are trying to approach it from a way that's as clear and straightforward as possible, but it isn't always that clear and straightforward to answer. So, we really try our best to give like specifics.
And that ties into Liz's question, which is, what advice do you give members who can't find the services they're approved for, like PCA or therapies or skills? It's sort of like what you're talking about. Do you hope like the care coordination people will help if they have them?
Yeah,
and then if they don't, what do you end up getting involved with that?
Right. Well, we would see if folks do have that care coordination benefit available. And if they don't, then we try to get as involved as we can. We can't, unfortunately, fill the role of a care coordinator. But in this situation, I think what Liz, you're mentioning is when folks are not able to find the providers, or they're not able to find the services even maybe vendors, agencies that can work. I know there's long waiting lists, there's staff shortages, there's so many things that have been harder to access due to the pandemic, amongst other things. So we might try to help folks find those vendors. Even if we can't do it on an ongoing basis, we might be able to do it just for that specific service and therapy that they might be looking for.
Great.
Yeah.
Well, Leslie, thank you very much. It's past or at 12:45. Usually that's when we stop.
Okay.
And really can't tell you how much I appreciate it. Would love to get the PDF, and we'll share that when the recording is all set to folks that were on. And we're going to make sure people hear about you. More business your way.
Thank you.
I'm sure. Yeah, happy to do it. Well, and people need you. So really glad.
We imagine there are more folks out there who don't know about us that need our support. So we would love to hear from you. Thank you.
All right. Have a great week, Leslie. Great having you. Have a great week, everybody.
Yeah.
We'll see you in a couple of weeks for Leo Live. And take care. Bye, Leslie. Take care.
Bye.
Thank you.
Bye, Leo.